First of all, changing anyone's diet is really hard. And Betsy just does a beautiful job in terms of educating both parents and children on how to do that. As a pediatric gastroenterologist, I treat a lot of conditions where nutritional therapy is really key to getting a patient to feel better, so that there's multiple instances in which Betsy has just been a tremendous help. For example, I see a number of children who have celiac disease, which is a gluten intolerance. And so for those patients, she'll instruct them on a gluten-free diet. I also see kids who have allergic bowel disease and may need to be on a restricted diet for that reason. Then I see kids who aren't growing well, that are not gaining weight well, and Betsy has instructed those children on how, and their parents on how to alter their diet so that they grow better and they gain weight. And finally, there's some kids who have irritable bowel or maybe lactose intolerant or fructose intolerant, and Betsy will instruct those patients on those types of diets. I think what I appreciate for what Betsy gives to my patients is really two things. First of all, she has a very solid education background, so she really knows her stuff and she knows what's kind of the correct nutritional therapy. And then finally, I think she's able to teach that in a very practical way. I think part of that comes from her being a mother, and part of it just comes from her being able to communicate with families and let them know how to make those dietary changes as part of their lives. I think she does that also by giving great handouts so that after parents and children are in with a visit, they have some written information that they can also refer back to.